Okay, so there's two different fat pads that people are sometimes bothered by after a breast reduction. So the first one is right here, and we call this the axillary fat pad, and the second one is right here on the sides of the chest, and that's called the bra roll. So let's start with the fat pad up here, this axillary fat pad. So this area is usually just fat, or it can also have some breast tissue. And removal of any tissue in this area is not part of a breast reduction. It's a totally separate procedure. So if it's just fat that you're removing, this is removed with liposuction. And if you have a lot of breast tissue, then you'll need a little incision right there, and the breast tissue can be excised directly and sent off to pathology as well. So sometimes this little axillary fat pad is not as noticeable before a breast reduction because the heavy weight of the breast tissue pulls everything down and kind of stretches it long, and so you don't quite notice it as much. And then once everything is lifted and perky, it kind of springs back up, and then all of a sudden it can be more noticeable. Now, if this is an area that bothers you, it can certainly be addressed at the time of the breast reduction. It only adds a short period of time onto your surgery usually and is not particularly expensive because remember, this is not part of a breast reduction, it's a separate procedure. Okay, so the next area is the bra roll. So this area is usually just a little extra fatty tissue, and then often if you have some looseness of your skin, it will kind of fold over and give you an indentation with like a little folded over appearance. So this is also an area that is not part of a breast reduction, but you can certainly have it addressed at the same time. Now, if you're having your breast reduction done in a vertical technique, when you narrow everything in the breast, it often pulls in and makes this bra roll area less noticeable. So unless you have a lot of fat or a lot of skin laxity, it often improves with a vertical breast reduction. If you're having a wise pattern or anchor pattern breast reduction, the surgeon can run the incision out very, very far and actually directly cut out skin and tissue in that area. The main downside of that, though, is that you have a much longer scar that can be visible in clothing. A more simple option is just doing some liposuction of the area. So if you don't have a ton of skin laxity, usually liposuction is the best option because you don't have a scar that's visible in that area and it can smooth the contour with little fuss. So it's really common after a breast reduction to become very aware of the area in a way you were not before. And so things that didn't really bother you or were kind of on the back burner all of a sudden bother you more. So the main focus for patients is these really large breasts that they just want smaller. And then once they get the breast they like, they start to notice other things that bother them. So I think it's really important as a patient, if you're going to have a breast reduction, you really sit down and think critically about this area on the side of your chest and the axilla and how much these things may potentially bother you after surgery. In my patient population, very few patients have anything done to this, and they're totally happy after surgery. I know there's some surgeons who try to upsell you into liposuction of everything, but I don't think the average patient probably needs it, to be honest, and you just have to be honest about what your goals are. So I hope that answered your question. Let me know if it didn't or if you have any additional questions.